Hello everyone. Today we are going to learn about pathology of gastrointestinal tract. Um, Disorders of the esophagus. It may be congenital abnormalities like typhus, stenosis, atresia, fistula, and it can cause in newborn aspirates while feeding, and pneumonia. Achalasia, lack of relaxation of cardiac sphincter, you can see, and inflammation leads to scarring and loss of ganglion cells. Decreased innervation means no relaxation and leads to retention of food, inflammation, and more scarring. And esophageal scarring and reinflammation. Inflammation leads scarring, loss of ganglion cells, and esophageal diverticule. It may be traction, pulsion, or magicians. Think at the verticulum, example of the pulsion types. Hiatal hernia. It may incompetence of the pragmatic opening. Portion of stomach is in thorax. The sliding type leads to regurgitation of food, acid reflux, or ulceration. In second type, rolling type, may lead to gastric mucosal ischemia and like ulceration or GI bleeding. Esophagitis, inflammation of mucosa, lots of causes, reflux of stomach acid, infection agents like bacteria, viral, fungal, and various change. It is conditions which normal squamous epithelium replaced by columnar epithelium. Metaplasia of squamous epithelium with columnar epithelium. But it's change. You can see in microscopically how replaced squamous cells are replaced by columnar cells. Esophageal varices, dilatation of esophageal veins, frequently distal parts of esophagus, increased venous portal pressure, and after cirrhosis and life-threatening hemorrhage. So patients may die with hemorrhage. Esophageal varices, and esophageal cancer. Squamous cell, repeat irritation, tobacco. It also invasive, and it may be started after Barrett's change. So Barrett's change preconditions of adenocarcinoma. Esophageal cancer, you can see how pathological this is, and disorders of stomach. Gastritis may be acute, chronic. Acute gastritis cold with polyps, with H. pylori, pain, bleeding, and the main influences like Helicobacter pylori, urease, toxins, and gastric acidity, peptic enzymetry, and this balance. These factors can lead the injury of the mucous layer of the gastra. And in chronic gastritis characterized by mucosal atrophy, mucin cell hyperlymphatitis, autoimmune, or B20 deficiency. Chronic gastritis. Chronic gastritis, in microscopically, you can see infiltration with lymphatitis. You can see also lymphocytes, macrophages, neutrophils, Helicobacter pylori. It is gram-negative rod lives on the epithelial surface, whereas destroys mucus, increases acid secretion, reduces judicial picard, intensifies inflammatory response, and immunogenic. Peptic ulcer, action of digestion, balance between good and evil. Helicobacter pylori, NSAIDs like aspirin, and complications may be bleeding, perforation, penetration, scarring. You can see there is scarring. It is a complication, one of the complications of the peptic ulcers. And in the rhinologic shadow, good and evil, yeah. The major forces and defensive forces. If this balance between these forces can lead peptic ulceration. Ulceration, it means defect of the mucosal, submucosal, maybe to serosal layer of the gastric. You can see four zone of the ulceration. It may necrotic debris, non-specific acute inflammation, granulation tissue, and fibrosis. Stress ulcers. This means stress ulcers. It is not surprise. Trauma, major heat injury, burns, vascular mediated rearranged blood flow, multiple erosions. Yeah, you can see confined to mucosa can bleed seriously. And next, gastric cancer. Gastric cancer, maybe adenocarcinoma, and risk factors. It is gastritis, smoked foods, chronic gastritis with Helicobacter pylori. This is adenocarcinoma and colloid carcinoma. Adenocarcinoma with colloid or mixed carcinoma. You can say exafit. How exafit types of cancer? Yeah, polypoid type of cancer. Small bowel disease. It includes mechanical problems in inguinal, umbilical, intussuspension, volvulus, adhesion. Intussusception. It means one of the part of the smaller intestine can enter to all the parts of the intestine with large diameter. Meckel's diverticulum, congenital diverticulum of the distal small bowel, 2 kinds of mucosa, 2 feet from the ileocecal valve, 2 inches in size, and twice as common in males. So problems with the Meckel's. It can be perforation, it can be hernia, it can be called a mechanical problems. Vascular related, bowel infection, maybe hemorrhagic, venous or arterial, septic shock, and it is very painful. We can see in these pictures thrombosis of mesenterical arteria. After it, you can see dark intestine. It means it is necrosis these parts of the intestine. because of thrombosis. Bowel infection. Infectious enteritis. Many agents infect the small bowel. Viral bacteria, bacteria Salmonella, or parasites like unicellular, multicellular. Non-infectious inflammatory. Crohn's disease. Crohn's disease or skip lesions, yeah. Granulomatous enteritis. It's transmural inflammation. Transmural, all of the layers of bowel is inflammation. Non-known infectious agent, granulomas in about 30%, fistula formation, relapsing small bowel or colon, and ethnicity, no significant increased risk of cancer, minimal at best. Crohn's disease, transmural inflammation, scarring and stricture formation, small bowel, and fistula, characterized by fistula. Crohn's microscopy, you can see granulomas about 30% of the time and transmural all the time. Gluten enteropathy. Gluten enteropathy, it means gluten non-suitable for these patients, and in the structure has many abnormality, like in celiac disease you can see atrophy of the mucosal cells, yeah. And these patients can't eat any piece of bread. It is so painful. It is so it is they don't eat bread from the colonic disease, Hirschsprung disease. And you can see a ganglion segment. What a ganglion segment? Peristalsis stops, dilatation of colon, backstream of the defective segment, remove distal portion that looks healthy, and look for ganglia. Ulcerative colitis, mucosal crypt abscesses, autoimmune element, starts in the rectum and works its way back. And pseudopolyps, toxic megacolon, and increased cancer risk. Ulcerative colitis, you can see. Crypt abscesses, you can see. Diverticulosis, when more diverticle in the bowels. Diverticulitis, diverticulitis is danger for it can inflammation, it can infection, injury. And colonic polyps, hyperplastic polyp, and adenoma. Adenomas pedunculated tubular, Cecilius. Colonic polyps, you can see also. Familial polyposis, when more polyp on the bowel, millions of adenomatous polyps, genetic predisposition, and 100% of chance of cancer. Familial polyposis in microscope, macroscopically, you can see. Colon cancer, right and left side have different presentation. Right, anemia, if the colon cancer localized on the right of side of the bowel, it can cause anemia. If on the left part of the bowel, it can bowel changes. Contributing factors may be genetics, dietary fiber, dietary fat, and spread to liver and lymph nodes. Genetics of colon cancer: normal colon mucosa at risk, adenomas, and after it maybe carcinoma, many genes. Appendicitis. Appendicitis is a inflammation of mucosa of the appendix and obstruction of mouth of appendix. It may be fecally enlarged lymph nodes, maybe bacteria proliferate and invade wall, and rupture may be called peritonitis and abscesses. You can see normal structure of the appendix and inflamed, so appendicitis. You can see enlarged of the size, hyperemia, and you can see edema of the appendix, inflamed appendix. Inguinal hernia, maybe it is surgical pathology, and it's all. Thank you for watching. Bye.